Hi, this is Teddy, and you're listening to Two Broads Talking Politics, part of the Demcast Podcast Network. The subject of today's episode is COVID-19 and social distancing. Please note that this podcast does not provide individual medical advice. If you have questions about your medical situation, you should call your personal doctor.
Hey everyone, this is Kelly with Two Broads Talking Politics, part of the Demcast family of podcasts. Podcasts are going to be even more important than they have been in the past, as we're about to talk about. I am joined today by my co-host Sophie. Hey Sophie.
Hey Kelly.
And our special guest today is Dr. Malia Jones, who works at the Applied Population Laboratory at the University of Wisconsin-Madison Center for Demography and Ecology. Hello, Dr. Jones.
Hello.
So, as people may guess from our guest, we are going to talk some about coronavirus today, COVID-19. We are not going to be focused on so much what the government should be doing. There's lots of politics of coronavirus that could be talked about, but what we want to talk about specifically today is about social distancing, the importance of that, and how that factors into the political landscape. So, Dr. Jones, could you start by just talking us a little bit about your work in general, what you do, and then you had a Google Doc that was going, no pun intended, viral a couple days ago, and you know, sort of what you were hoping to do with that.
Sure. So what I do is I'm a social epidemiologist, and my work focuses on people who don't want to vaccinate their kids, actually, and how spatial clustering of those people affects epidemic risk. So I study epidemics, and I have a PhD and a master's in public health. And I wrote that Google Doc actually as an email to my friends and family because I was starting to get a lot of questions as news about COVID-19 in the United States was breaking. I wrote it on that day, last Thursday, because CDC changed their guidance about who could be tested for COVID-19 the previous day. And so I was anticipating a big uptick and a lot of news coming out about COVID-19. And I just wanted to sort of preemptively answer some questions that I was starting to get a lot of. And so my points really focused on basic public health and hygiene strategies like washing your hands, and one of the points that I made was about social distancing.
So what is social distancing? We'll start there, and then we can sort of talk through what that means practically.
Yeah. So social distancing is this concept that, so COVID-19 is caused by a virus, a new strain of coronavirus. The coronavirus family has a lot of different kinds of viruses. Some of them make people sick, some of them don't. This one is new for humans, and we don't know a whole lot about it at this point. It really, the very first cases were just a little bit over 3 months ago, and so we're scrambling to get what information we can. But we know a little bit about other similar coronaviruses from other outbreaks like SARS, and there's another one called the Middle Eastern Respiratory Syndrome, MERS, CoV. And so based on what we know about similar viruses, we think that COVID-19 is spread by close contact. So that means that the way you get it is you're near someone who's coughing or sneezing. When you cough or sneeze, some spit or snot flies out of your mouth or nose and goes into the air for a short amount of time while it flies along sort of a trajectory until it falls onto some surface. So if you're close to someone, sort of within the sneeze range, then you can breathe in those droplets and get sick that way. And we think that that range is about 6 feet. And so you want to stay 6 feet away from sick people, which means that public health is asking a lot of people to stay away from large crowds, just in case there's a sick person in the large crowds. The other part of that is to sanitize surfaces that those droplets could have fallen on. So there's kind of two parts to social distancing. One of them is to stay away from people, and the second one is to practice good hygiene.
So one of the reasons that we on this podcast and also with Dumbcast more largely are thinking a lot about social distancing is that so much of the way we practice politics in this country involves a lot of in-person, large events. We're seeing all over the country presidential candidates, for instance, going around, flying on planes, going from place to place, doing big rallies with lots of people. So what are the kinds of concerns that you would have? What are the ways that something like COVID-19 can be, can not necessarily infect more people, but infect more people more quickly if people are doing things like these big rallies? How do these things interact?
Right. So the question that a lot of people are asking is about how fast the outbreak is spreading. And it is spreading really fast. And so social distancing, part of the goal is to slow it down. And the challenge with a big crowd of people is that, you can just imagine you have a group of 1,000 people gathered at a rally, and one of them is sick with this disease and is coughing. And as they're going around coughing into the air, those droplets are flying around and getting into other people's respiratory systems. And in a large crowd, that contact rate is really high. You can get a lot of people sick in a short amount of time. And so that's why the public health recommendation is to avoid large crowds. Right now, CDC's official recommendation is to avoid crowded spaces only if you are a high-risk person. So if you have respiratory disease already, or you're in the older age groups that are higher risk for a severe case of COVID-19. More generally, public health as a community is really worried about the speed of the spread of the infection, and even young, healthy people are at risk for passing the disease along. And so I think the more general good advice would be to avoid large crowds entirely.
Can you talk a little bit about sort of the purpose of slowing down the virus? Because at first blush, my first thought when this happened was, well, I can't stay away from people forever, and so as soon as I go back to my routines, won't it keep spreading? So can you talk a little bit about why it's important to slow the virus down?
Yes. So I think this is a challenging point to make, and it's really an important one. So if we assume there's 7.7 billion people in the world, and we can assume that they're all susceptible to this virus because nobody's ever had it before. If the virus spreads super rapidly through that, big population of susceptible people, then it will quickly overwhelm the healthcare system because we'll have a lot of people needing to be hospitalized and needing to be put on respirators and needing medication all at one time. Right. So if we have, let's assume we're going to have, I don't know, just spitballing 10,000 cases in the United States. If all those 10,000 cases happen in the next 3 weeks, the healthcare system is going to be in really big trouble, and people won't be able to get respirators when they need them. But if the same 10,000 people get sick over the course of the next 6 months, then we'll be able to keep up with demand, and we'll be able to provide much better supportive care and get more people better. And so it really is important to slow roll the epidemic, even if everybody still gets sick in the end. Does that make sense?
Yes, it does.
And I think that's the point that a lot of people, including me, have been sort of slow to get to. I think a lot of people think, well, we can just wait for the social distancing until there's an outbreak. But it sounds like what we're saying here is that we should start those measures earlier to prevent a large outbreak happening all at once.
Yeah, public health is in a really tough position right now. And I'm talking about county and state and even CDC, our federal public health body, because we don't want to overreact and tell everybody, oh, God, stay home, the sky is falling, if it's really not going to be that bad, because it's very disruptive to people's lives, and it'll hurt the economy, and it'll hurt people's jobs, people will be out of work, so on and so forth. However, we have to balance that against the real risks that there's going to be this huge outbreak and that people will die of COVID-19. And how many people will die is something that we want to limit as much as possible. And so it's a tough argument to make, and I really feel for people who are in positions of authority making these calls about canceling events because it is really hard to balance the risks.
So we have talked some about sort of large crowds and what that looks like. What is a large crowd in this context, and is the risk lower if you're talking about a small group? How should people be thinking through making those decisions?
A couple people have asked me that, and it's really hard to answer because we do not know how many people are already infected. And so it's not possible without that key piece of information to calculate the individual risk based on how many people you're coming into contact with. That's kind of a technical answer, but I would say the bigger the crowd, the worse it is. And, if a crowd starts at sort of our normal daily interactions at work and then goes up to unique events that maybe involve lots more people, there's a range there in terms of risk. And I just don't know, I can't directly answer because we just don't have the information right now about how risky a crowd of some size is.
So we shouldn't be in large crowds, but a lot of campaigning is sort of like one-on-one, going to people's houses, shaking hands, distributing literature. What are some of the things we should be keeping in mind in terms of one-on-one campaigning? Is it okay to bring literature around, or is that if we're not talking to people directly, or is that still going to transmit the virus?
So a piece of campaign literature hypothetically could get dirty with disease. What we know so far suggests that people who are not symptomatic are not likely to transmit disease. So I would say if the person handing out the literature is well, and they practice good hygiene about not letting other people cough all over it, then the literature itself is probably very low risk. This is similar to what I've been telling people about groceries from the grocery store and other materials that they're bringing into their house. You can only do so much before you go crazy, and we can't just shut down society entirely. So you can do what you can, which would be to limit the number of people who are handling the literature itself and make sure that those people are well. I would also suggest a lot of hand washing. Shaking hands is one of the best ways to transmit something on your hand from one person to another. And so if you're shaking hands with people, I would really suggest using hand sanitizer as much as you can, or just saying we're in the middle of a COVID-19 outbreak, so we're going to bump elbows today instead of shaking hands.
I'm advocating for everyone to do the Spock, Falcon City.
Yeah, definitely.
Might be a little nerdy, but I'm hoping it catches on.
I agree with you.
We've been doing peace signs at church.
Oh, yeah. Well, no,
peace signs, that's another good option. I've seen people bumping shoes.
Yeah.
Sort of a foot tap instead of shaking hands.
My kids like that option a lot.
Mm-hmm.
I have a question that is not related to campaigning, but is related to this virus, and it's driving me nuts, so I have to ask you. Why are they asking us to use hand sanitizer? Isn't this a virus?
Yes. So some hand sanitizers only kill bacteria, and they will not kill this virus. But hand sanitizers that have at least 60% isopropyl alcohol or rubbing alcohol as their active ingredient will kill most viruses. And we think it will kill this virus. Hand washing is a better solution. Well, it will kill other coronaviruses. I haven't seen anyone verify that it will kill this particular coronavirus, but we know that 60% concentration isopropyl alcohol will kill other coronaviruses. So it's a fairly good assumption. Hand washing works better. If you have a choice, you should wash your hands with soap and water for at least 20 seconds. But if you can't, then you can use a hand sanitizer that contains alcohol as its main ingredient.
So I think, this brings up a lot of challenges for campaigns, certainly things like door knocking, large rallies. Luckily, technology is pretty advanced at this point. So I think there's some definite recommendations that people can do. Have you seen academics groups, for instance, start to use other methods of gathering and meetings and things like that, are there ways that you would suggest that people could start thinking about other things besides gathering in person?
I have definitely seen a lot of universities planning for classes to go entirely online. University classrooms are a similar kind of contact event, where you have a lot of people from a lot of different places all in one room for an hour or so. And some universities in areas that have active cases and there's a lot of uncertainty have already gone online, and other universities are planning for that. In terms of meetings in the academic world, a lot of our conferences, professional meetings have been canceled or have gone entirely online. And I've seen a number of different platforms to host those, both the classes and the academic meetings, so that people can drop in and drop out of the sessions that they need to attend or hold discussions in an online format. Personally, I use Zoom for all of my remote meetings, and I'm trying to do that as much as possible at this point.
So I am going to start pulling together some of this information about different platforms and things that can be used, things like Zoom and Skype and Google Duo and things like that. And I'm going to put together a document that I'll put on the Dumbcast website. And I'm going to also offer my personal services to campaigns that would like to sort of think through, brainstorm what they can do. Because I think there's a real risk here, of course, that if everyone cancels all the in-person events, that's going to seriously hurt campaigns at a very crucial moment in the 2020 election cycle. But I think there's a lot we can do to get around that and mitigate some of that. I would certainly recommend that people go on podcasts. I think that would be a great way to get your message out.
Do you think it would be even more effective to go onto podcasts and digital media in terms of efficiency of getting your message out? I've been sort of wondering about this since you asked me to come on the podcast. Yeah,
so I think in some ways it can be. The thing you lose on a podcast, for instance, would be the interaction with the crowd. So, it's sort of a one-on-one conversation. I think that can be extremely useful for certain kinds of messaging. I think, I would, even before this, have strongly recommended that all candidates do some podcasts. I think people are reaching people they wouldn't otherwise, and so I think that can be extremely useful. You can't then answer questions from the audience, for instance, on a podcast. So I think things like Facebook Live or Zoom could be very valuable for that sort of thing, like a town hall style. So I think that probably doing as many different kinds of things as possible, just like you would in-person campaigning, is also useful in the digital sphere.
And I think that's applicable to people who aren't necessarily in campaign mode either, who are current office holders. You can do a virtual town hall instead of bringing everybody together. You can send out emails instead of meeting in person. So I think that's probably applicable even if you're not actively campaigning right now.
I would personally love it if my representatives would do virtual town halls more. I have 2 young children and a job, and so it's not always real easy for me to go over to the in-person event that they've invited me to.
Yeah, I think, we can see, too, that virtual town halls and campaigning and all of that is good for all sorts of people. So people with kids and particular schedules, definitely people who are housebound for various other reasons, people who have trouble navigating transportation. There can be lots of reasons that it's good to have these options. There's research that suggests that in-person campaigning, things like knocking doors, is very valuable and good for campaigns. And when you can do that, I think having multiple avenues is probably the best thing. But certainly in a moment where it's not a good idea to have large in-person events, then I think a lot of it can be done virtually.
Mm-hmm.
All right. So I think that gives us a really good overview of why this is so important and why it's important to think about right now and not wait until there's 1,000 sick people in your town before implementing it. Or there could already be 1,000 sick people in your town and we just don't know it. So that I think is super important to be thinking about. I would love feedback from any candidates or campaign managers or anyone who's listening who has thought through ideas of methods that could be used. I've seen things like Twitter town halls where there's someone sort of asking the questions and then the candidate is responding and you use the same hashtag so people can follow along. So I think that could be a really fun thing to experiment with too. So if people have ideas, I hope you will contact us, email, Facebook, Twitter. We're easy to get a hold of, and let us know what ideas you have, or if you need help thinking through it. I'm here for that as well. Are there other things that we would like to make sure that we talked about that we mentioned right now?
So one thing I was just thinking about the campaign question specifically is I imagine a lot of candidates are wondering how long is this going to go on, trying to think about how to plan their campaign out through the fall election. And the answer to that question is we don't know, but the more we do now to slow the spread of the outbreak, the shorter we'll have to deal with this, the shorter time we'll have to deal with this. So measures that we take now are going to be more effective than things that we're trying to do over the summer. I would expect things are getting worse in the United States right now. That's very clear. And I would expect that to go on happening for at least a few weeks. And I would expect summer plans to be very disrupted. After summer, I have no idea where we'll be. It's next to impossible to predict. And I guess the other thing I would add is that it doesn't really look like this is all going to fizzle out, but there is a chance that we'll sort of get our public health act together and control the outbreak, and this will not be news by the end of April. And that would be an awesome win for public health, and I really hope that's the scenario. So time will tell.
All right, fingers crossed. In the meantime, if you haven't voted yet and you have the opportunity still to request a mail-in ballot, that is probably a very good idea. We're working with some people to start pulling together some information about how to get mail-in ballots across the country, and certainly looking toward fall, we should all be thinking about that as an option if you've already voted in primaries. All right. Well, Dr. Jones, thank you so much for joining us today. This has been extremely helpful. I am certainly a person who is prone to illness anxiety, and I've been trying to make sure I understand the best information possible and keep up to date without panicking or causing other people to panic.
Yeah. Did I say don't panic? I don't know if I said that, but
don't panic.
Don't panic. Panic is very unhelpful. So just do what you can and don't go crazy.
All right. Sounds good. Thank you. And to everybody, let's keep in touch on this issue. This is rapidly changing, new information constantly, but it's very good to start preparing and planning as soon as possible.
Thank you for listening to Two Broads Talking Politics, part of the Dimcast Podcast Network. Our theme song is called Are You Listening? Off of the album Elephant Shaped Trees by the band Immunuri, and we're using it with permission of the band. Our logo and other original artwork is by Matthew Weflin and was created for use by this podcast. You can contact us at twobroadstalkingpolitics@gmail.com or on Twitter or Facebook at Two Broads Talk. You can find all of our episodes at twobroadstalkingpolitics.com or anywhere podcasts are found.